welcome everyone to our CRV Medical Center's first town hall of 2022. So if it's a little bit, if it doesn't run smoothly, it's our first one of the year, so please bear with us. My name is Kimberley Pryor-DeShazo. I am the Marketing Director, Public Relations Director, and Foundation Director for CRV Medical Center. And I am joined today by Donna Hefner. She is the CEO and President of CRV Medical Center. And then also with Sean Roberts. And Sean is the, he works for Imperial Ambulance and is the operations manager for Imperial Ambulance. Is that correct, Sean?
That is correct.
Okay, good. I already lost my place on my agenda, see? So today's forum, today we'll be discussing questions surrounding COVID-19. We opened up questions beforehand, and when we received those to our marketing inbox. So we'll first start with asking those, and I'm just gonna pivot back and forth between the two of you. If you don't know the answer to one, but the other one might know the answer, then you guys, of course, can trade off or maybe work in tandem together to answer the question. And then once we complete those previous questions that came in already, we will go ahead and switch to open questions that Alita Verduzco Silva, our community relations manager, will be feeding to me on the back end. So, okay, hopefully everyone is ready and welcome. I'm gonna go ahead and start with Donna for the first preliminary question that came in, okay? Okay, so Donna, what is the hospital doing to get more staff to take care of patients right now?
Yes, so the hospital is under a state surge hospital, which means that we are recognized under the California Department of Public Health. So we've been working very closely in regards to the state for staffing since Labor Day. So I've had the opportunity and pleasure to work with them directly. And it has been a big challenge since about Labor Day, but this newest surge has presented some new challenges. So what we've been able to ascertain is that we've been able to obtain registered nursing travelers. We at one time had a physician that was in the ER that helped us with kind of assessing, treating, and as they would say, discharging from the ER, as well as case management. We also had a pharmacist that was deployed to us to help with the monoclonal antibodies and some of that work that we have been trying to do on an outpatient basis where we've been bringing patients in. So we've been able to, those are some of the unique positions, but most of the support has been around registered nurses and travelers that have come up from all over different states. So we've been very, very thankful. To date, we have 21 travelers allocated from the state, but we have a total of over 60 travelers in our organization right now. So.
Wow. So when we put out the call, we've had it answered, is what you're saying.
Put out the call and ongoing, the community might not know this, but 7 days a week we have been reporting our numbers out to the state and as well as local authorities. So we've been collaborating well with communicating this information, and the information has been updated over time where the state's been looking at collecting new information. So our team here has been adjusting. We have to have our reports in by 9 o'clock in the morning, and that's on a daily basis. That's Sunday as well. And so we've been very vigilant about that and super happy with the support that we've been able to get and feedback. I seek out the feedback of how we're doing with reporting our information up, and that really helps the state monitor and give information out to the community at large. So I'm really happy with that process.
Okay, great. Thanks, Donna. Okay, Sean, this question comes over to you. If the vaccine doesn't prevent getting COVID-19, then why should I get it?
And I think that's an excellent question, and that is a question that everybody should be asking for an answer for. And I think, unfortunately, sometimes in the media, it has not been properly answered. The reason you want to get the vaccine is it prevents severe illness, hospitalization, and death. The vaccine is not going to prevent you from getting mild cold-like symptoms in a lot of cases. For a lot of people, it will, but there will be a significant number of breakthrough infections. And I think that at some point we need to, address that elephant in the room and be like, honestly, there's going to be a lot of mild breakthrough infections. But severe illness, hospitalization, death, the need for supplemental oxygen, long haul COVID syndrome, ventilator dependent situations, all of those are dramatically lessened by the vaccine. So while you may be under the weather at home for a couple of days with a breakthrough infection, it's far better than being in the emergency room, being in the intensive care unit, having to go to rehab or anything like that. So the vaccine prevents the worst possible outcomes. And that's why we highly encourage everyone to get vaccinated. In a perfect world, we'd love a vaccine that prevents us from ever getting sick. But at this point, the vaccine is a million times better than nothing. And we really don't want to see you with severe illness or death.
Yeah, no, agreed. That's great. Thank you so much. Okay, all right, over to you, Donna. Is it safe to even come into the hospital right now that we're seeing this most recent surge with the Omicron variant, as well as still having Delta variant cases come through our doors?
Yes. So let's talk about some of the processes we put in place. I mean, we've been in the last 2 years through a number of changes from having no visitation to having visitation. And so what our main focus has been from the day one, and as we've learned to adjust and modify these processes and plans, is around the safety of our employees as well as the safety of our patients. And so that has been the key focus. So with that, it's been able to allow visitation back, because we know that's important. So if you're coming here as a visitor, we are asking you to bring your vaccination card. We are asking you to wear your mask coming into the facility. And then we're asking you, if you aren't vaccinated and you don't have your mask, you have to bring a test result that was done within 72 hours if you're going to be visiting. Our visitation still at this time is around the state mandate, the orders there. And so we allow visitation to patients that are non-COVID. And then we have visitation around those special unique identifiers, which is adults that are dependent on a caregiver, pediatrics, or end of life. So that's around the visitation. So if you're coming as a visitor, we have processes to keep you safe, but we really are focused on trying to keep our patients and our staff safe. So you might hear some of my colleagues talk about running 2 unique hospitals, such as a hospital that is not infectious, so we call it clean, or those that have COVID-like symptoms, which is present with the infection. So we keep one unit dedicated, which is 34 beds dedicated to those that have COVID. So just to ensure the safety. And then we have a lot of other unique things to keep people safe, such as HEPA filters. And we've actually today went back to a process in the ER where 4 dedicated rooms are for patients that come in with COVID-like symptoms. It has a HEPA filter, and so you got to keep the team safe and the patient safe as well. So we keep modifying every day based on the surge and the pressure points that we have. But obviously, it is safe to come to the hospital and seek care. We just ask for our community to do their part, put their mask on, and come through the appropriate doors.
Okay, great. It sounds like we're very safe, and we definitely don't want people delaying that care, especially in emergent times. So thank you, Donna. That was great. Okay, back over to you, Sean. Okay, so this came through. My family members felt horrible after getting the vaccine. I feel like I would rather get COVID. Can you tell us what the pros and cons are and the risks behind kind of that thought process?
Yeah, absolutely. With this or with any medical procedure, it's a risk-benefit analysis. Does the risk outweigh the possible benefit, or vice versa? With the COVID vaccine, we strongly believe that the benefits outweigh any risk. You may feel sick for several days. You may get a mild flu-like symptoms. You may get a headache. You absolutely might get that. It would be dishonest to say you might not experience any of these side effects. But on one hand, they're actually a good thing, because it means your immune system recognizes the spike protein and is now reacting to it. But also, all of these symptoms are going to be self-limiting because the vaccine does not contain any live virus. You're not being infected with COVID. It's your immune system responding to the spike protein, so they're self-limited. With getting the COVID infection, it runs the gamut. Yes, the truth of the matter is, and again, full honesty, most people do have mild COVID-like symptoms and recover with just rest at home. but there is a significant minority of the population of all ages and all demographics that develop very severe symptoms. And those symptoms are not self-limiting. And those can lead to severe illness. They can lead to hospitalization. They can lead to maybe not a severe illness, but a life-disrupting illness, some long-haul symptoms, residual shortness of breath, and all of that. The vaccine helps prevent that. So it's almost like paying up front. You feel pretty bad sometimes for a couple of days, but in the end, it could save you weeks, if not months, of feeling bad or even worse, hospitalization. So that is a completely legitimate question, and there are people that do not feel well after the vaccine. And if you don't, there are recommendations from the CDC with over-the-counter pain medications and other stuff to kind of mitigate those symptoms. But in general, we strongly feel that the data supports that getting the vaccine is much safer than getting COVID and letting it run its course in your body.
And then as well, when you get the vaccine, Sean, does it lower the transmission rate as well?
Again, we're trying to be fully honest here. When you initially get COVID and your viral load is high enough that you're experiencing symptoms, yes, there's a significant chance that you're infectious. But the data is increasingly showing that the vaccine helps you clear the virus, which means get rid of the virus, or you're not having what we call replication competent virus. Basically, you can't transmit it. You're infectious for a shorter period of time than you would without the vaccine. So it's not going to give you a zero risk of transmitting COVID. And to say so would be completely dishonest. What it's going to do in the long run is make you infectious for less time, have your viral load clear faster, and reduce the period of time that you can infect other people. So it's kind of a win-win situation like that as well.
Okay, all right, great, thank you. Okay, over to Donna. If the vaccine was supposed to end the virus, why are we still in the pandemic? Oh, you're on mute, Donna.
Sorry, I was hearing a little background noise, so I was trying to silence my side of the audience. I was just going to touch on why are we seeing another strain of the which is known as the Omicron, which is the more prevalent strain that we're seeing now. Doesn't mean that we don't have still the Delta prevalent in our community. Our county has been doing a great job on the genome sequencing that is determining that, and Dr. Ha has been very forthcoming with information. But as we know with viruses, they mutate. And as they mutate, then that's how we have new strains, and that's why they've been assigned different names. And so that was when we started back in 2019, it was called the COVID-19 coronavirus. And as we've gone along this journey for the last couple of years, that's why we now have Delta and Omicron. And so it will continue to mutate, and we will continue to have different strains. But obviously the CDC has come up with some new recommendations, and with this strain, and based on the predictions of what they saw in other countries, we're seeing it come and hit our community pretty hard, and it's going fast. We were up to over 87 employees out who tested positive just last week. And that was the most I'd ever seen. And so everybody is reacting differently to this strain. But again, it's a lot of them are recovering quickly. And, we could say that it's contributed to the vaccination, or we can say it's contributed to many other factors, but we have seen just a huge response from Sean and our partnership with Imperial and the city on vaccination, and very pleased with that response. So, but yes, we are going to continue to see new strains, and to say we could eradicate it in the next year, I don't think that's being said. So,
sure, yeah, and that is a great partnership that we have with Imperial and with the city, and we are going gangbusters there with vaccinations. Just 3,000 at our last Vax Roundup. So that's been great. Okay, all right, over to you, Sean. So next question is, I'm very healthy and am usually able to fight things off. Why do you think I would need the vaccine?
We recommend everybody gets vaccinated because, number one, this is a novel virus. Unless you have recovered from COVID in the past, It's going to be your body's first encounter with COVID if you're not unvaccinated, and you don't know what the outcome is. And it gives you more tools to fight the virus. It's like your car. Obviously, most of our modern vehicles have airbags, but that doesn't mean you don't wear your seatbelt. It doesn't mean you disable your airbag because you're wearing your seatbelt. What you want is every tool in the toolbox to keep you safe if the unexpected happens, such as a car accident. This vaccine is the same way. It is a really important tool in our toolbox that helps your body fight it off, because it's not going to be the first time your body has encountered what it believes to be the coronavirus. Again, I need to be straightforward. There's no live virus in the vaccine, so we are not putting coronavirus in your body, but the spike protein causes your body to make the antibodies. But you don't want to be unprotected. So it's like the social distancing measures, the hand washing, all of that, that's like your airbag. The vaccine's like your seatbelt. And it basically gives you the best chance to have the most positive outcome if and when your body does encounter this virus.
Mhm.
Okay, all right, great, thank you. Okay, back over to you, Donna. Similar to a question we had a little earlier, if the hospital is at capacity, which I know we were close to that, or we've been close to that again, does that mean that I will not be treated?
No, it does not mean you're not going to. We are treating everybody. We ask that you be patient with us. We have experienced it, through this last surge, which I call it the fourth surge. We have various capacity. So today is a snapshot in time where we had to open up our second inpatient COVID unit. But just last week, we were in one unit. So we are adjusting, very focused on the operations. Every single day, we have huddles at 8 o'clock and at 4 o'clock with all of leadership. About 30 people are on the call, and we're navigating what barriers we have, what issues are we presented with staffing, and trying to mitigate so our community that seeks care is having the best care possible with the right staff. So it's an ongoing everyday issue. But today I have to say that, just last night we admitted 11 patients with positive with COVID, which, a day ago we had only been averaging about, 2 to 4. So the length of stay is a lot shorter with this surge, this Omicron, than we saw with Delta. But that said, we just kind of keep navigating. So we do at various times are at 100% capacity, like today in the ICU, but that'll change day to day. So we do still continue to have capacity.
Okay, all right, great, thank you. All right, back over to you, Sean. I already got COVID, so why should I get the vaccine?
That's another excellent question that people should be asking. And the reason is because your natural immunity from prior infection does diminish over time. And that's not unique to COVID. It's not unique to COVID by any means. Most upper respiratory infections are the same. That's why most of us have gotten a flu more than once in our life. Most of us have gotten a cold more than once in our life, because eventually your immunity dwindles. What vaccination does is it kind of boosts that immunity back up. And that is very important, because now you're going to have those neutralizing antibodies. It's going to help your B cells, your T cells, your body to recognize the virus when it comes back. Omicron in particular is well known for reinfection. The data coming out of South Africa, where it was first identified, showed that it was by exponential numbers more likely than other variants to reinfect people. And the data coming from all over the world, from Israel, from South Africa, et cetera, shows that immunity from previous infection is not lifelong to COVID. So what the vaccine does is it gives your body every possible tool to fight this disease if you encounter it again. And that is so very important, because maybe you recovered well the first time, maybe the second time is going to be more serious. And once again, like I say, it's like you want every single tool in your toolbox to fight this, because it's your body and we want you to remain healthy. And while we are here as your EMS providers, your hospital, to care for you in any circumstance, no matter what, we will always be here for you. We'd prefer if you were healthy at home. We don't want you to have to come to the hospital, and the vaccine is so important to prevent that from happening.
Okay, great, thank you much. Okay, back over to you, Donna. So as the president of Sierra View, what do you recommend to keep our kids safe?
Yes, so with our kids, it's so great to see them back in school. I have to say, first off, it was so much pressure. I know the schools were very concerned, and they worked hard at trying to put processes in place. But one thing our kids are is resilient. I have to say, I was at one time when I was on the floor taking care of kids. They can do two things. They can get well really fast, or they can get sick really fast. So one thing that we like to do with our to teach our kids, and which our teachers are doing a great job, is hand washing, covering their coughs with their arms so they're not coughing and sneezing on each other, as well as, and then also and I see our kids just watching us as parents to make sure, we're cleaning all the time with surfaces, and the Lysol is the perfect tool in our, as Sean mentioned, in our tool chest to kill the coronavirus. And our director of environmental services reminds me of that often, is how great to have Lysol that you can just spray and kill it. So that's encouraging. But to keep our kids, obviously parents and adults trying just to educate them and help them be aware. But it's amazing how many kids you see in the community using masks, and they're doing so well. When they first started, they were like putting the ties in their mouth, and now they're keeping it on their face. And again, as Sean mentioned, we've got to build up our immunity too. So I know we're going to start to see maybe a lot more sniffles and things like that, as we typically do in the winter months. We see the influenza, and like last year we had a very low influenza year, but now we are starting to see cases. So a few. So I just wanted to mention is, for the kids, obviously hand washing, frequently covering their cough, sneezes, things like that, and parents helping to support the process is really. I think I had a friend tell me online that says, if you want your kids to grow up to be fine adults, they're just watching you. And so they are constantly mimicking everything that we're doing. And so I just say, great job to all the parents out there. It's hard work. And it's just great to see the kids going back to school and really being conscientious about trying to keep their friends safe, but get to socialize with each other. So you get me talking about kids, and I got a soft spot. So you can't.
That's great. We call that the vampire cough in our house, Donna, like the Count from Sesame Street. So to all my kids, cough like into your elbow. So thank you. That was great. Okay, next question will be coming over to Sean. Sean, that's interesting. Okay, wait. Okay, yeah, this is you. So Donna actually mentioned this a little bit earlier, so I know the answer. Does Sierra Medical Center offer the monoclonal therapy that works against the Omicron? Someone had heard that they don't.
For me, yes, that treatment is available in our county. It's in partnership with Sierra View, with Tulare County Public Health. Dr. Hott, our public health director for this county, is a huge advocate of monoclonal antibodies. Additionally, we do have some of the antiviral pills in limited quantities coming to Tulare County. They will be available in the community very soon if they are not already. But once again, these are tools in the toolbox. But we don't want you to get to the point where you need monoclonal antibodies. We don't want you to get to the point where you need the antiviral pill. We want you to remain healthy and either not infected with mild illness. If you do happen to need them, they're going to be there for you. But again, we want every single precaution to be taken so you don't actually get to that level. And it can give you more of a peace of mind that, your basic measures, your hand washing, your social distancing, coupled with your vaccine, reduces the chance that you'll get the infection or that it'll be severe. If it starts getting more severe, then we do have the monoclonal antibodies, increased antivirals, which is great. But let's try not to get to that point in the first place. And that's why we highly encourage vaccination. But be assured, if you do get sick, vaccinated or unvaccinated, we are doing everything in our power to make sure that you have the best treatments available to you in our community.
Okay, great. Thank you. Donna, anything else you'd like to add before we turn it over to the open questions from today's chat?
Yes, I just wanted to underscore what Sean was saying about the monoclonal antibodies. And so if an individual is under the treatment of their physician, the physician will send the order to our direct admit line. And so our Director of Acute Care, Brandy Irwin, has been coordinating that on a daily basis, and then working with our manager of pharmacy, who actually has teamed up to ensure that we're given the right monoclonal antibodies for each person. So yes, they come into the facility, they get an infusion by that is monitored by a registered nurse, and then they're and then after the infusion is given, they're monitored for a short period of time to make sure they have no reaction, and then they are discharged home to recover. So we are doing that on the acute care, not in the ER, but on the acute care basis. So yes, and we've been very, very successful. We get our allocation though from the state, and we are monitoring that very closely, because at times we're in sometimes a short supply. So, but the allocations have been coming. So I don't have anything else to add, Kim. Again, I have to say, managing through a pandemic in healthcare has got to be one of the biggest challenges, I think, as any of us have ever experienced. And we just appreciate the feedback of our community. I have had so many people tell me stories, their personal stories, which kind of keeps me persevering. And I've gotten to be in the vaccine clinic with Sean, and be able to see kids come through and get their vaccination, and see adults, and you know, we're giving boosters, and it's just been really it's a huge effort. It's not just one of us. It takes a true partnership at all levels, the city, the county, the state. And I have to say, through this pandemic and my 30 years of experience of healthcare, I have to say the one thing I probably have taken away from this is how important it is to communicate outside and across those lines, because communication and just talking with other colleagues and networking and coming together to navigate when are you bringing your employees back, and being aligned around the same processes as we navigate some very uncharted territory has been very, very helpful. And that's probably one of the things that I'd hope would continue after the pandemic's over, is that we continue the collaboration and the communication that has been opened up to us at Sierra View from all levels throughout the state and just within our county. So very, very thankful, because I'm not sure that I used to have those open communications. I've seen Sean more in the last year than I probably have in his whole career. So it's again, really hope that that's what we take away as healthcare leaders, is that continued partnership is key to keeping people healthy and taken care of.
Okay, great. Yeah, partnership with the county, the state, with our local hospitals. All of us have been working so closely together. So it's been really nice.
Mm-hmm.
Okay, Sean, so I'm going to go ahead. I'm going to switch over to the community questions, a few of them that have started to come through. So the first one's for you, and it is, how do we get parents to realize how important it is for everyone to have their kids vaccinated? So I guess talking more to that 5 to 11 or even 5 to 18 age group.
Well, I think the key to that is having the conversation with your pediatrician, because I'm a parent myself. And if I'm going to have something medically done to my son, I want to know everything about it. So first of all, is like you were saying, is the communication, lines of communication. Ask your child's pediatrician, their primary care physician. Talk about the benefits of the vaccination, and not just the COVID vaccination, but vaccinations in general. Unfortunately, a lot of childhood vaccinations have been pushed off by this pandemic because doctors' offices have been closed. And we have to remember that COVID's not the only thing, but it is one of the most pressing matters now. So I think it's really important to have those open lines of communication between your healthcare provider and your child, because you can find anything on the internet, one way or the other. But once you establish that relationship with your child's doctor who knows your child, then a lot of that can be cleared up. So I highly encourage all parents considering vaccination to contact your pediatrician and get all of your questions answered, because your pediatricians are waiting with open arms to answer those questions. They're really wanting to collaborate with you on the care for your child. So I think that communication, like we've talked about, is the first step to realizing that, you know, it's not random idea. It's very much supported by the scientific community.
Okay, great. Yeah, agreed. Thank you so much. Okay, next question coming in is for Donna. So Donna, how many times can someone get COVID-19?
Like Sean mentioned, we have seen people that have been infected more than once. And unfortunately, each time they don't, this last Omicron, the clinical symptom that's been probably the most prevalent is intense fatigue. In the Delta, it was loss of taste or smell. Loss of taste and smell has been kind of coming a few days later, but that intense fatigue, sore throat, scratchy throat. So again, a person can get it multiple times, and I do know people that have had multiple strains, and again, their antibodies are being built up, but again, that's the answer. It can happen. So
yeah. Okay. All right. Thank you. Okay, Sean, back over to you. Is a rash a normal side effect of COVID-19? And when should people ask for help if they're experiencing this?
I would say first and foremost, there are atypical presentations of COVID-19. And there is some evidence that rashes can be associated with it. Or if you're wondering about the vaccine, there is some association that rashes can be associated with the vaccine in mild allergic reactions as well. If the symptoms are mild, again, it's best to contact your primary care physician. If they are severe, coupled by shortness of breath, coupled by hives, accompanied by any what we call a systemic reaction, affects other body systems, your respiratory system, your cardiovascular system. If you happen to get a rash like that associated with severe shortness of breath, call 911 immediately. We're your local paramedics. We will come out. We will assess you. We will get you to the hospital if necessary. But for otherwise mild reactions or complications of COVID, again, that's the conversation to have with your primary care physician, because it's a novel virus. There's not a ton that's known about it overall, and it seems like every day there's a new symptom coming out and stuff like that. Who would have ever thought all of us would have lost our smell and taste over a virus? So there are these rather novel and atypical presentations.
Okay, great. Thank you. Okay, another one for Sean. So the community has, they've sent over a lot of testing questions. So a few of those being, number one, where can they get rapid tests? And where can they get public testing done? And then of course, at Sierra View Medical Center, we offer testing, but that is by appointment only. You have to be referred from your doctor or from the urgent care that you're coming from. So Sean, can you give us a little bit more details on those two?
Yes. As far as there's two types of testing. There's the rapid test, oftentimes what you also hear described as a lateral flow test, as well as the PCR testing, which is a more advanced laboratory test. The PCR testing is available Monday through Thursday at Porterville College in their student center, which is by the cafeteria. You can enter off of College Avenue. It's in between Plano and Main Street. Appointments are recommended because it makes it a little bit easier. They have all your information. You can just walk in, but walk-ins are accepted. As far as lateral flow tests, the state and federal government are making a great effort to try to make sure that they are available to the general public. At this point, there obviously is a shortage of those, but there are urgent cares and clinics in the community that do offer them, not just in Porterville, but in Tulare and Visalia. But what we would say is make sure you call, because right now, unfortunately, a lot of times the demand for testing is now outpacing the supply of tests available. But if you want the PCR test, which is an accurate test that gets sent to a lab, takes a little bit longer, Monday through Thursday at Porterville College. You could also go to the Tulare County Health and Human Services website, and they're constantly updating where testing is available. If you live in one of the more outlying communities, there are mobile testing units. They take a bus out there that are on a fixed schedule in the more rural communities. So the county and the state are making all efforts to make sure more testing is available. But for those of you that live in Porterville, Monday through Thursday, Porterville College, that site is always open and has a lot of staff in it.
Okay, great. And for Visalia, I live in Visalia, like Coweta Health rather. They have quite a few testing locations as well with their quick cares and their urgent cares. And then myturn.gov, of course, for vaccinations. You can't do testing through that though, correct? No. Okay, Donna, anything to add with our testing site location?
Yes, so we moved for our employees in the last week because we've had so many employees with symptoms. We moved to testing with our partnership with Imperial here in the hospital, but we still have our drive-through where it requires a physician's order, and then the person comes through the medical office building on the corner of Pearson to actually get the specimen collected, and then that gets sent off to the county for the results. So results take about, we're seeing now about 48 hours to 72 at times because of the amount of people being tested. You can just see on the county's website how many people positive last week compared to today has been a significant increase. And that's as a result of testing results. So again, if you think you have symptoms, my encouragement is the first question you always will be asked by your provider is, have you been exposed to someone with COVID? What are your symptoms? And they're going to screen that to rule that out the first and foremost. So testing is something that's very, very important.
This question could come to either one of you, but say you test at home with one of your at-home tests that you ordered off of Amazon and it comes back positive. Do you recommend still following up and getting that PCR test done just to confirm, or following up with your primary care provider?
Yes. The home tests are not a confirmatory test for the PCR, which is the nasal pharyngeal swab that is the confirmatory test. So, because we have seen those, depending on the person's symptomology, they're not reliable as a sole test. They have to be followed up with a PCR.
Okay, great. Okay, one more question for you, Sean. Can you tell us more about the vaccination clinic and what people can expect? And can you remind us of how important it is to get a booster? We haven't talked that much about boosters today, so just elaborate a little bit more on that as well.
Absolutely. I'll start with the booster. The vaccine triggers your immune system. So just like your natural immunity does wane over time, your vaccine-induced immunity does wane over time as well. And now we're seeing at periods greater than 6 to 8 months, the vaccine-induced immunity waning, natural infection-induced immunity waning. So the booster shot, what that does is it gets you back up to a level that your body can effectively fight the virus. And it's not unique to any vaccination. Most of us have gotten a tetanus booster in our life. Your hepatitis B shot is a 3-shot regimen, the 3rd shot being 6 months out. So boosters are very much a tool in the tool chest, so to speak. So boosters are not unique by any means to the COVID vaccine. But what this booster does is it gets your body's antibodies up so it can fight the virus more effectively. Typically, the symptoms associated with a booster shot are mild. There's a lot of people that even report no side effects with the booster shot. So if you tolerated the first 2 well, chances are you are going to tolerate the booster shot well. It's exceedingly rare there's any kind of significant reaction to it. So we encourage anybody that has been over 5 months, which is what California Department of Public Health makes it available, to get your booster shot. Or if it's been more than 2 months after the Johnson & Johnson 1-dose regimen, just because that's a viral vector vaccine. It's a little bit different than mRNA, so it's not quite as effective with these variants. So if it's been more than 2 months for J&J, more than 5 months for Pfizer or Moderna, we highly encourage a booster shot. Our vaccine clinic is open from 9 a.m. to 6 p.m. Thursdays, Fridays, Saturdays. It's at 385 Pearson Drive, corner of Pearson and Morton in the old dialysis building. You can get an appointment on my turn, but walk-ins are always welcome. We vaccinate anybody ages 5 and over in accordance with CDC guidelines. So we do have the pediatric vaccine. For Pfizer, we offer first dose, second dose, and booster. But if you have gotten Moderna in the past, we do offer the Moderna booster as well. If you have received Johnson & Johnson, it is your choice. If you come to our clinic, you can get either a Pfizer booster or a Moderna booster. We require very minimal information. Your immigration status does not matter. We want all members of our community regardless of their immigration status, to be protected, because we are one community, and it's so important that nobody be marginalized in this pandemic. It's so important that we get vaccines to everybody in an equitable distribution of it. So we realize that vaccination is a deeply personal decision, and it is your decision. But if you are ready for us, we are ready for you to get you vaccinated, and we will do everything we can to make it a quick and painless experience. And you could be on your way to immunity, whether you're 5 years old, whether you're 95 years old, whether it's your first dose, whether it's your booster. We're waiting for you, and we are ready for you.
Okay, great. Thanks. Really quick on the children, 5 to 11, Sean, back to you. That is just Pfizer, correct? And we're doing first and second doses?
Yes, we are doing first and second doses. It is the Pfizer pediatric vaccine. We set it up in a different station with lots of safety procedures. It is a different colored vial. It is a different dilution mechanism. It is drawn up by somebody specifically dedicated to that, and it is administered by an RN that is employed by Sierra View Medical Center. We take every precaution. So pediatric Pfizer never goes anywhere near the adult Pfizer because there were some pretty significant issues with that up north when the vaccine was first rolled out. We have seen what happened up north, and we have taken every single safety precaution. So it is Pfizer only, and we are ready to vaccinate you, and we take every safety precaution to make sure your child is vaccinated completely safely with all of the precautions taken. And I know a lot of people are nervous because, it's nervous when you get a shot. What if there's a reaction? Well, they're exceedingly rare, but also you're being vaccinated by your community's paramedics, EMTs, and nurses. So we're the people that care for you on a daily basis. We are always going to be here for you. So in the unlikely event that anything does happen, you're already in the care of paramedics, EMTs with all of our equipment and nurses. So you are in good hands no matter what. We're also ready to answer any questions. If you are unsure about vaccination and want to talk to us before you get the vaccine, we'd love to have that conversation with you. If you choose not to get it, that's your choice. It's a very low pressure environment. Like, we want to make sure that you get the most accurate information, and we make it as easy as possible for you to make the decisions with the most accurate information.
And as far as boosters go, kids 5 to 11, no boosters yet, correct?
No, that's because the vaccine has been so newly approved that it has not been out for the 5 months. Additionally, they are doing ongoing studies to see how immunity is in children as it goes on, with time goes on. All of this stuff is done based off what the science says. So it's unknown if there will be a booster or will not. It really determines on the level of immunity spaced out from when you got the vaccine.
Okay, great. One more question over to you about boosters, Donna. Do you foresee a fourth shot or a fourth boost or a second booster, I guess, following your 2 previous vaccines?
Yes, the CDC is starting to, obviously, that's a consideration of the 4th booster. So again, there's not been as far as I'm aware at this time, there's not been a definitive time frame, but we are, based on the current system, we are encouraging everybody to get their booster at this time. When they're in that period of time, which is, like Sean said, 5 months past the second dose. So you're in the window of booster eligible is what we call it. And if you're booster eligible for a healthcare professional, we are in the process of all of our employees that got the vaccination early on, they're at their eligibility, so they're having to get their booster now. So we're in the process of meeting that deadline by February 1st. And currently we have employees that are doing ongoing testing as well. So if they're under an exemption, they do ongoing testing, or if they haven't got their booster yet, they're doing testing as well. So
great. And then, of course, to mirror or to piggyback what Sean had said about our vaccination clinic, which is Thursday, Friday, and Saturdays from 9 to 6. We do have another vaccine roundup, which is a partnership between Sierra View, the city of Porterville, and Imperial Ambulance, where we have been giving out $100 gift cards through the American Rescue Plan Act with the city, funded gift cards to all local businesses. So really bringing back that money into the local economy, which has been a really great partnership for us. And that will be January 27th, 28th, and 29th. So not this weekend, but the following weekend, your opportunity to once again snag one of those $100 gift cards if you can. So we don't have any more questions coming through the channel. So I guess in conclusion, anything else you would like to add? First, I'll ask that to Sean, and then we'll end with you, Donna.
The only thing I'd like to add is Porterville and the surrounding areas are a wonderful community. There's a lot of wonderful people there that have been through a lot in the last couple of years, and it's been on our honor and our privilege to serve you on your best days and on your worst days. We genuinely care about you. We want you to be healthy. We want you to be well. We want your families to be healthy, and we want your families to be well. And that's why we really promote the vaccine so much, because it is because we care about you and we want you to be as healthy as possible. This is a wonderful community full of wonderful people, and it breaks our heart when people are sick. It breaks our heart when people are hospitalized with what possibly could have been prevented. So we're just asking for your help. We will always care for you, vaccinated, unvaccinated, it doesn't matter. We will always care for you with the best, most compassionate care possible. But we would just want you to be safe and take those precautions. So thank you, Porterville. You're a wonderful community. It's been an honor to serve you.
And Donna?
Well, that gives me goosebumps. So thanks, Sean. I really do appreciate your words of affirmation about the community. It really, truly is a great community. And I know you've had worldwide experiences, just getting to talk to you personally out on the sidewalk. And I just really appreciate you being a part of our community and serving the community. As well, we're here for our community, and having said that, we have a team that's willing and able to, and it's been serving tirelessly, and they will continue to do so. And I liked how you said it, vaccinated or unvaccinated, we're here for you, because I have been a recipient of our services, and it is truly a time of uncertainty when you're sick and you're trying to figure out how to navigate healthcare. So feel free to use us as just to ask questions. Don't be afraid to pick up the phone and call us. We're here for you 24/7, every day of the year. And so we will walk through this with you together. We will continue to share the latest information that we have, because obviously it keeps changing. So if you feel like it's different tomorrow, just know that we're reading every single day and staying very current with the latest, greatest. As Sean mentioned, there's tons of studies going on out there in the world in regards to helping us navigate this. So we will continue to bring you up to speed as we know the latest information, and keep improving on our processes to provide safe and high quality care to you and your family. So it's truly an honor to serve the healthcare in our community, and to serve with the partnerships we have. Kim, thanks for being a facilitator today.
Yeah, thank you so much to both of you. Thank you for taking time out of both your very busy schedules. I know it's hard to get away. Hopefully we'll be able to do this more throughout 2022. I think it's great to be here and just open this format for people to ask the questions that are on their minds. We also have our Facebook, Instagram, social media channels that we're constantly updating and trying to make sure we have the most current information available to everyone. So use that as a tool as well, a resource in case you're wondering anything. So again, I really appreciate it. Both Sean and Donna, you guys did a great job today. We appreciate you guys, and we appreciate everything that Imperial and CRVU is doing. So this concludes our session. So thank you so much.